Welcome, everyone, to the Health Equity Jam session for September 2025. We're excited to see you all and looking forward to even more people joining us um, over the next few minutes. I'm really excited to welcome our speaker for today, Dr. Charles Mathias. I'm going to tell you more about him. Uh, First, though, we're going to do our fun facts, and then we'll do a more formal sort of introduction. So I hope everybody had a good summer, by the way. I know there's been a lot going on. So uh, it's really good to see you all. And I hope that, this will be like the beginning of a great academic year. When we signed off in June, I think we were talking about just remembering that we're in solidarity here through tough times, and we still have a lot of work to do. So we're not getting weary at all. So I'm really excited to share some fun facts about our speaker, and then we will go into the formal introduction. So he's got some really interesting fun facts. Sometimes, Dr. Mathias, sometimes what I do is to have people guess and put their guesses in the chat about what the answer is to the question. So Dr. Mathias has had an interesting career, um, and he's impacted a lot of people. So it's about his career, and then it's also about his life. So there's one particular fun fact about him that involves him impacting a lot of people. So can anybody take a guess as to what that event was? What that particular experience was where he really impacted a lot of people? Any guesses? We our speakers have done all kinds of interesting things. So, oh, people want hints. This is not, you guys, come on. I'm not giving any hints out. Is he a singer or performer? Plays an instrument? Okay. Quite a broad question. I agree. Well, it's kind of hard to give hints on this one. So I think I'm going to let Dr. Mathias tell us how he impacted a lot of people and what exactly happened.
Those were great guesses. TED Talk, presentations, television. That's what I would think of as, scholars and academics on how we might reach a lot of folks at once. But the single event where I impacted a lot of people all at the same moment was I got in a vehicle accident on I-10 in New Orleans at rush hour and basically shut down all the traffic. And many people made it home later that night than they had hoped to. So everybody's okay. Nobody was hurt, but it would make me realize how little events in our day can make big changes in our plans.
We're glad to see we're glad you're safe, and it sounds like nobody else was like badly injured or anything.
No, no, just the
Yeah,
cars.
yeah, yeah. Fender benders. Was it like a storm, an ice storm or something, or bad weather, or just one of
It,
those days?
we were approaching a hill and it was right, the sun was just right in,
Mhm.
the driver's eyes behind us and they didn't see us. So we stopped quickly and they kind of got up under us and it was kind of exciting because it lifted our car up and kind of flipped us over on our side and we went skidding down the road and we actually had to climb out the sunroof to get out of the car and
Oh my
my wife
goodness.
my wife had kind of negotiated with her parents that she really wanted a sunroof in her car and it paid off for us.
Yeah, I know. I never thought about that, about using the sunroof to get out of the car. But anyway, well, we're glad you made it through safely, and I'm sure public health maybe saved your life because you probably had your seatbelt on.
For
So,
sure.
so let's see. There's another really interesting, fun fact about Dr. Mathias that involves health. So, I don't know. I'm not sure how to give clues to this one. Got any ideas, Dr. Mathias?
No, I was kind of unaware of this issue until it hit me.
Okay, I will tell you guys what the fun fact is, and then he will explain how he learned about this issue. So, Dr. Mathias has something that's called a cross-reactive allergy. So, does anybody else have that, or has anybody heard of a cross-reactive allergy, or know what that looks like? Nope. Okay.
So,
Well,
so
I'm
the
gonna
so the
take
concept
it.
is the concept is you can kind of become sensitized to one allergen and then react very strongly to another one. And I was not aware of this, but I grew up in northern Indiana, and I, as a child, get stung by wasps sometimes. I never had an issue before. And then when I went to graduate school in New Orleans, they had fire ants, and I'd never been exposed to it before. And typically, when you interact with fire ants, you're stepping on them, and you have a reaction, on your lower extremities. And over time, each time I get stung by them, I would have a stronger and stronger reaction. So, like first my ankle would swell, and then my calf, and then the next time it was all the way up my leg. So it was pretty strong reactions. But because it's your lower extremities, it's not, threatening your airways or anything. But then when I was back home, after having never had a problem with wasps before, I got stung by a wasp in my face area, and that kind of ignited the same kind of reaction I had to fire ants. But because it was around my airway, it was more serious. So now I have EpiPen.
I told Dr. Mathias that after all of this, like doing a health equity jam session will be a piece of cake. So we're not going to cause any trouble like that for him here. So, like, what before we go on to the last fun fact, I just wanted you to tell us about the music you chose. How did you guys like that song? Tell us um, about your taste in music, and it was good.
Well, I select that song because I find it very uplifting. My daughter was a cross country runner in high school, and we'd always try and get her hyped, before she had to compete. So that was
Mhm.
one of the songs that she always enjoyed listening to get ready for her races.
I like it. It was very, very upbeat. I like that. So, okay, there's another one. I think you've got some like what is it? A proclivity for adventure. That's what I'll call it. So tell us another fun fact about something that you learned when traveling.
So I was on a flight to Washington, D.C., and 2 rows in front of me was an elderly woman traveling with her daughter, and she stopped breathing. It was quite serious. And we were about 45 minutes from the airport. And I learned at that time, we have a typical thing that we're used to on the kind of descent and, towards the airport. And once you get on the ground, how long that takes to get around the airport. But I found that in a medical emergency, it's quite different. They basically kind of clear the traffic, and the pilot, really goes quite rapidly to the airport, to get to emergency help. But the thing that struck me the most is I think we've all had this experience of being on a plane where there's turbulence and you kind of bounce up and down in your seat. And, that's why we got to wear our seatbelts, right? Even when we're in flight. But what was just so surreal was we were one flying so quickly, but descending so quickly that by this point, the woman who's not breathing was pulled into the aisle, and they had a physician on the plane and a medic who happened to be passengers there working with her. But we were descending so rapidly that they all lifted up off the floor, and it wasn't like the turbulence where you go up and down. Like they came off the floor, were just like levitating there for what felt like a very long time. And then once we got onto the tarmac and landed, again, we've got this thing we're used to with the taxiing. It feels like it takes another 15 minutes to get to our gate, but boy, we're booking it out over there to get to the EMS crew, and luckily the medic and the physician had gotten the woman rebreathing, but before we had landed, and everybody seemed to be okay. But it was a very different kind of landing than I've ever experienced before.
So I'm sure we all have stories. I don't know if we have any that are that dramatic about flying, but anyway, well, thanks for sharing that with us. So let me move more into a formal introduction of Dr. Mathias Charles. He brings over 25 years of experience at the intersection of behavioral health research and policy. He's led state and federal research programs that advance the science of behavioral health and shaped criminal justice policies for individuals living with mental illness. He's a former Robert Wood Johnson Foundation Health Policy Fellow, and he served as a staffer in the U.S. Senate, where he worked on Medicaid policies to strengthen care for mental illness and substance use disorders. And currently, Charles directs the Texas Consortium for the Non-Medical Drivers of Health. It's a statewide initiative focused on addressing health-related social needs within the healthcare delivery system. And he's a fellow with Rice University's Baker Institute for Public Policy. He earned his bachelor's degree in psychology from Indiana University and his PhD in applied biopsychology from University of New Orleans. So without further ado, first of all, I should say I met Dr. Mathias. I met you was it in May of
That's
this
right.
year? Yeah, I met him in San Antonio, Texas, and he gave I thought, one of the best talks on just the basics of advocacy work for researchers. And so I really wanted him to come here and talk to our health equity researchers and trainees. And then he and I actually just saw each other last week again in Dallas. So we keep running into each other these days. So without further ado, Dr. Charles Mathias.
Thank you, Dr. Cooper. I appreciate the invitation. I'm so glad to be here and share the story with the jammers. There's, a couple ways that I could tell the story, and the way I've decided to focus it is on for the perspective of members of the session who might not regularly participate in advocacy or education outreach with policymakers. And I recognize, there might be other members on this call who have a great deal of expertise and have their own experiences in how this goes. But this is kind of an intro for folks that maybe have not gotten engaged with policy work. And for academics and scholars, I think all of us feel very over committed in the number of things that we're responsible for and try to fit that into our schedule. And I just want to assure you that advocacy and engagement with policy doesn't have to be a burden on your schedule or a distraction from your real job. It actually can be incorporated within kind of your routine in a way that is feasible for your schedule, but also allows you to have impact above and beyond the other areas where you have influence. Now, when I've done this kind of talk before, it oftentimes was challenging to convince academics or scholars that policy engagement was really relevant to them. And I think that's changed in recent history as we've seen changes to the funding landscape. For instance, NIH, where a lot of my time was spent conducting research. We more directly see the impacts that policies can have on the work that we do. But beyond, I would just encourage you to think about this issue of policy and policy impact as not just about, how you obtain funding to do the important work that you do to advance health, but actually how you promote health in the U.S. and the world more broadly. Because policy ultimately determines what we kind of can and can't do in a research arena, in terms of what we study and how we study it. There's a lot of different policies and guidelines, as you're aware, through your human subjects protection or your animal protections training. All those are different kinds of policies, right? So policy is really vital in kind of putting guardrails and boundaries on what we can do as scholars. So it's not just about the funding, it's about, how we go about doing the work that we do. Policy is also really important for engagement standards and institutionalizing those and making engagement and community engagement, a formalized process that's kind of built into what we do. And as one example, the NIH, all of us study that a number of you may be familiar with, um, is one example where community engagement really benefited from new policies that came down from the NIH. And then finally, policy is one way that we can translate findings that we have from the scholarship that we do into actual practice. If you think about, a medication, if you work with medication trials, for instance, once you've demonstrated, medication's effective and safe for treating an illness or a condition, there's a lot of other policy steps that have to take place for that to finally kind of go out into the world and be beneficial for people. And those policies have to do with, the pricing of that medication, how it ends up on insurance formularies, and how it's paid for, under what conditions it's marketed and sold under. So policies, are critical in, guiding the way the work that we do ends up kind of being out into the real world in a way. So just like you to, just be aware it touches us in many different ways. This is a figure from the Translational Science Benefits Model from Washington University in St. Louis, and it's the NCATS uses this quite often. And in this model, it shows from left to right, we have resources that allow us to conduct our scientific activities. And a lot of us spend most of our effort in the scientific activities box, right? If you're a scholar or a researcher, at least, you're spending your time, generating data and analyses and interpretation to create generalizable knowledge, right? And the outcome of that work, are scientific outputs, which tend to be, academic journals. And that's one way, we're evaluated and rated as academics, is that we have those journal publications, we've got those presentations to the academic community, and that really informs the scientific process, right? Because as we share our findings, that influences not only, what our next studies may be, but it influences the other members of the scientific community out there who also study, similar phenomenon. So it's very important for the advancement of science. But when we think about, well, how does these findings translate into impact in the real world? We kind of have to move over to the right side of this figure. And this is where the translational science benefits come into play. So translational, one way science may be translated as changes in clinical care, whether it's medications or procedures or services that we offer in the clinic. It may be changes in the community and public health initiatives and ways we reach community members. There could be economic advantages or changes that come about based on findings that we have. And then the final mechanism or lever for having impact based on our evidence is through the policy arena. And the policy arena is a very valuable avenue to pursue as a scientist because it allows you to kind of have influence on kind of practices or procedures that impact health in very broad ways. So whenever we talk about policy, I always try and make the important distinction between policy and politics. So policies are kind of the rules or the regulations or procedures or payment mechanisms that we use to make some operation happen. And we have policies, at our own organizations. We've got policies, more at the legislative or executive branch levels. Um, but those policies are oftentimes difficult to enact. There's a lot of structures built into organizations and the policy-making arms of organizations that make it difficult to enact new policies. And that's partly out of self-preservation, because if we just made a new policy, every day, at some point the entire operation would come grinding to a halt. We have to be judicious in how policies are enacted and implemented so the overall mission of the organization can continue to move forward. So that sounds kind of academic and very dry, and calm, which is different sometimes than politics. And so politics, I heard this good quote. I forget who it's from, but I always liked it. Um, they said that, politics is really the vehicle that's used for making policy change happen. Because we have these structures in place that make new policy or policy change or implementation difficult to enact. And politics is kind of a negotiating mechanism that allows those kind of changes to happen. So it's important to appreciate that distinction between policy and politics. Um, if you haven't read it, there's a good book that I really found thought-provoking called *Sapiens* by Yuval Harari. And one of his premises in the book is that, the way researchers or academics or scholars approach kind of the discovery process is very different than, the other actors in our environment that, fund this kind of work and make policies about it. So I think for a lot of us in academia and research, the thrill of discovery is kind of an intrinsic thing that we share. We really want to understand, how things work, and we use our research methodologies to make these discoveries. And because it's an intrinsic process, it's just the joy of discovery drives, the passion that we need to do this work. So I know all of us on here spend on our nights and weekends, trying to make our research operations successful. And to have that drive, you've got to have, something inside of you that pushes you. But for the rest of the world, like, that's really not what they're asking for from us. They do want to see like a return, on the investment that's made in the research that we do. As you know, there's a variety of different funding mechanisms for research, ranging from governments to private foundations and even individuals. But the biggest single funder is our governments, both in the United States and across other countries. And for governments, when they invest in research, they really are seeking that the outcomes of that research advance an ideology, according to the hypothesis from Dr. Harari. So the evidence that's coming out of that is paired with, a perspective, a political perspective to kind of advance, an agenda. And I think, a lot of us don't think of our research as being political or intended to advance that agenda, but really when we look at, why as a country do we put so many dollars into research, we want to have growth in a certain sector, whether that's health, whether that's economic impact. It's a way to affect change. And the National Academies of Medicine has a great publication called Issues in Science and Technology, and it's published out of University of Arizona. one of their recent articles was making the point that um, it's important for research universities to articulate to the public and to policymakers kind of the value of the work they do by connecting, the outcomes that we're generating with, what is the impact on that on U.S. human capital or economic security? Because we're, in a kind of a competitive space in the world, right? On these economic issues and security issues, and research can be a mechanism that kind of speaks to that piece. But it's really on a burden on scholars to be aware and be able to articulate, what are those connections? Why is it important what you do help us as a nation be successful? And, I think there's a lot of different voices who connect with policymakers, and they come from all different kinds of backgrounds and agendas and skills and strengths. And when I think about scholars, I think what sets us apart is that we can be kind of taking a stance as an honest broker of information. We have extensive expertise and deep knowledge on very specific issues, and we spend a great deal of time synthesizing that in a way that policymakers and their staff might not have that time to get in depth on an issue. So we can really be an educator to inform them on kind of the nuances of different topics. What is the evidence that's available? Also, what are the unknowns? I think as academics, we're always aware, like there's caveats to most things that we find, even things that are effective, there's always exceptions to that. So we want to be able to articulate, the limitations of what we know as well, but also to kind of connect that with what are policy options that lawmakers may consider. It's not enough just to go tell them the evidence, like, okay, this medication or this procedure is safe and effective, but like, how does that relate to, how that procedure is delivered clinically? It's ultimately, if it's in the Medicaid program, what are the policy options within Medicaid for how that service might be delivered? So you kind of have to connect not only your knowledge of the evidence, but connecting that with mechanisms that might be enacted in the real world. And as policymakers, connecting with academics and scholars, a barrier sometimes can be how we communicate, because we communicate in very, very different ways. I think the entire, academic process is really a training ground for us to kind of learn to communicate in ways that is very effective within the academic community and helps, the scientific process move forward. We use very specific language in the work that we do. And sometimes that doesn't translate very well to, the general public or policymakers. So we've got to learn to meet them where they are and be able to communicate in ways where we can really kind of land the meaning and the intent behind what we're trying to convey when we communicate with them. So this was an article I really enjoyed by Dr. Embret and Randall. Um, and they made the point that researchers often hold the misguided belief that advocacy is based on just the evidence, and that alone is sufficient to move the agenda. But what they point out that's lacking from that assumption is that, you know, we need policymakers need help in understanding not just like what needs to be done or what is the problem, but what are solutions and how would you deliver that solution? Um, I think probably the most common line that I see in discussion uh, sections of academic articles that I read is, making the point like more research is needed, basically, which is always true for the scientific process to continue. But for non-academics, that does kind of come across sometimes as self-serving of like, just give us more research dollars to keep doing this. Um, and I think it's a somewhat like at the surface level of, the influence we're trying to have. Ultimately, if we're trying to affect change in the world, we really need to be connecting with that deeper level of how do these findings interact with how implementation might actually happen and what are policy levers for making that come about in the real world. Um, so I talked about this issue of kind of barriers and the style of communication that we tend to choose in academia versus the general public or policymakers. And as academics, we understand the importance of accuracy and dealing with the complexity of evidence. And that can really come across sometimes as a non-answer to non-scientists. It sounds like you're saying, well, we just don't know. So, and I'm not suggesting that you want to be inaccurate in the way you convey evidence to a policy community, but you need to think about how to convey it in a way that describes like, well, what is it that we do know? What are the implications of what we know on like a policy question or like a real world problem that, we're struggling with? And then what are particular policy mechanisms for acting on that problem? I think another common mistake I see in academia when we're making these connections is sometimes we'll talk about evidence and a solution that is really not enactable in the real world. Whether that be because it's extremely expensive, if this was delivered to everyone in the United States. It could just be impractical, just logistically for delivering. It could be that we don't know about unintended consequences for other secondary considerations. So that appreciation for practically how would you deliver this sometimes are left out when we are focused so solely on like the accuracy of the best evidence that we have. We've got to connect that evidence with feasible implementation. Um, and policymakers are having to make decisions with in contexts where there's not complete evidence. We don't have all the evidence we would like. That creates situations where there's uncertainty. And when we think about the scientific method, we're really disproving the null hypothesis, right? So we're constantly, kind of ruling factors out. But that still leaves a lot of questions and uncertainty. So how do we engage with policymakers, given that we have that style of speaking about our evidence? Again, it's talking about, well, what do we know? What are the things that are kind of there's consensus around as established givens, and what are options for implementation within those? And how can policy uh, be enacted that utilizes the evidence to create some kind of change or good in the world? This is Ben Bernanke, a former chair of the Fed. Um, he made the point that policy making involves a lot of things besides just the technical facts. And the technical facts or the evidence is where we spend a lot of our time, but those facts and that evidence is kind of paired with politics, which is again a mechanism for moving policy. Um, Also important is just relationships and gathering coalitions together to get consensus or enough people uh, involved that really believe in a solution to make it move. And then having these conversations in the context that there is remaining uncertainty, and there's always incomplete data, but sometimes we have to make decisions on decisions that affect people's lives, based on what we currently know. And that's a big responsibility. And that's where all these other factors beyond just the p-values, that we generated come in. So, what's the solution? I've kind of painted a picture that there's some friction or some challenges in our ability to kind of communicate effectively between scholars and policymakers, but I don't want you to think that that's all doom and gloom. There's actually some really great evidence of how to be successful in these kind of engagements. Um, and one approach or kind of model, if you will, is this evidence-based policy movement. And this movement is about trying to get interactions and relationships and dialogue between the scientific community and policymakers. And there's a number of different organizations that engage in this kind of activity. A number of our professional organizations, like the American Heart Association, has a really strong program that allows members to uh, participate in dialogue with policymakers. This publication that I'm citing here is from an organization at Penn State called the Research to Policy Collaboration, or Trestle Link, and they have a program that kind of matches the scientific community with policymakers. And I'll tell you a little bit more about them a little bit later. But what I really like about the Research to Policy Collaboration is they've actually used our own kind of methodologies and tools to demonstrate that this works. They actually conducted a randomized controlled trial that paired researchers with congressional offices. And they had an intervention group where researchers used kind of a manualized problem-solving model to kind of provide evidence, light touch of support to offices where they might have given those offices publicly available, scientific articles or materials, but they didn't really provide in-depth synthesis and ongoing dialogue like the intervention group did. And what they found was an actually significant difference between intervention and control groups in the number or percentage of offices who actually included evidence as part of the bill language for bills that they introduced. About 70% in the intervention group and less than 45% in the control groups, and it was an odds ratio of 2.86. So it had like a pretty substantial impact on congressional offices' use of evidence. And it was a fairly short time period, 6 months, but this was in the U.S. Congress, 405 bills introduced. 108 of those included evidence-based language in them. So these kind of interactions, a more in-depth dialogue, provision of synthesis for policymakers, and really being a resource as an honest broker again to answer questions that policymakers have, can have an impact on the way they do policy. Now, if you look at who is interacting with policymakers from the top to the bottom, we kind of show in the green colors more interactions with policymakers. So the folks who have the most interaction with policymakers are other government officials, and this was a study that was done at the county level. It's not at the Capitol Hill. But the county level, most often policymakers interact with other policymakers. But coming in second are, grassroots organizations and community leaders and business leaders. But way down here at the bottom, you can see hardly any green at all. Very infrequent, up to never interactions with researchers or at colleges within or outside their region. So there's very little crossover, at least between local policymakers and the academic community. And when they poll policymakers to ask, like, would they like to have more interactions with the academic community, 74% of policymakers express a desire, like, yes, I want to have these conversations. Um, um, Scholars bring a different perspective and a different kind of evidence than I get from business leaders or community leaders. And it's helpful for me to kind of develop a more cross-cutting solution if I have these different kinds of inputs. So the desire is there from policymakers, but we're not getting out there. And I think, it's a professional obligation, in my perspective, that we do have these kind of interactions. Now, within the academic community, my perception is um, there is an emphasis to kind of be recognized for communications and impact that you have within the academic community and speaking to other um, researchers or scholars who are in your field of study. That's where usually our ratings come from in terms of the metrics that we're evaluated on. And as a result, we kind of disincentivize speaking outside of the academic community. In fact, I think, some folks will have a bias in a way that there's this perception that if you're in the public media, maybe you're not like as traditional of an academic, or maybe you're not a real researcher if you're pursuing ways to be in the public media. That's a perception. They actually did a study at the Royal Society in the United Kingdom. Um, and one of the findings they had from that study was within the academic community, is kind of frowned upon that you would be speaking to the public. But then that same study kind of looked at, well, who is successful? Who are the people who are very recognizable within the public? And they actually found that those people also had some of the best research credentials. So this bias that we have about, oh, being in the media is maybe not very academic of you, doesn't agree with the actual evidence. So speaking to the public is really valuable because it's one way that you can gain access to relationships with policymakers. I found it to be a surprise when I served in the U.S. Senate, but when we're there in offices that I interacted with, when they were looking for scientific evidence, the PubMed and the academic journals were not the first places that people looked. They said, well, who's somebody who's speaking about this in a public forum where my constituents might have seen them, might be familiar with the way they're talking about this issue. And so that public visibility is a really important way for gaining access and relationships with policymakers. And the challenge within academia is like it's really not something that we're evaluated on. And that can feel like a real competition for our time between, getting those publications and presentations versus spending time, with popular media. But I'll make the case that it actually is very feasible if you've done all the work it takes to, secure funding for a research project, you've collected your evidence and synthesized it, and now you've published it for an academic forum. It's a really just a minutia of effort to translate that, more scholarly work into a more lay audience or public friendly way of speaking about what's the implications of what it is that you found. And I think for a very minimal investment of your time and effort, you can drastically expand the impact that your evidence has on the world. So there's a variety of different ways you could speak to, the public and raise awareness about the work that you do. One mechanism that I really find valuable and especially in the context of, busy academic life are op-eds. And I love this description from Duke University. They called an op-ed a technology for communication from experts to policymakers. I thought that was a really cool way to talk about it. So an op-ed, as many of you are aware, are very brief descriptions that appear. They used to appear in printed newspapers. They were called op-eds because they were opposite or the other page across from the editorial page of newspapers. The New York Times was the first one that had these op-eds where guests could write in and present a perspective or a frame for how to think about different issues. And the reason why I like this technology is it can have like really broad visibility very quickly. And it's something that, most of us with some practice can assemble relatively quickly. You've got all this background knowledge and information already from, the literature reviews and the work that you do. An op-ed is really just kind of assembling that to make, one point about an issue. And usually it's about, it's going to be accepted as an op-ed in a paper if it's an issue that's kind of in the public interest and people are talking about this issue. And an op-ed is a good way for you to kind of bring a perspective to that conversation. So it's very brief. A lot of these are 750 words or less. You really only have room to make one point, and you want to explain to people, why is this important? Why should they care? An op-ed also gives you a great opportunity to acknowledge like there's other perspectives or maybe competing or contradictory perspectives to what you're presenting. But it gives you a chance to kind of acknowledge that perspective and kind of make your counter argument, if you will. And op-eds are, usually written from the perspective of, your personal voice, meaning like, why are you an important person to kind of speak on this topic? Like, do you have special, is this your area of research or do you have personal experience with whatever this topic is? It's kind of bringing in, your personal background more so in a way than you would for an academic publication. So I find this a really valuable tool, limited time. It could be high visibility, and bring you connections that kind of bring you into dialogue with policymakers. Another, mm, I think the point we're trying to get to in interaction in the policy arena is to be in dialogue, in conversations with offices. And a number of you may be very experienced in this, but for those who've not had this experience before, a typical office visit, if it's the first time that you're going to visit an office, you've never met with them before, um, this is kind of what it looks like. So um, you're welcome to go around the Capitol and knock on doors and see if anybody has the time to meet with you, or if you're uh, working with an organization, they might have somebody who helps get you on the schedule, and you have a assigned time to be there. Lots of times, what offices do is they'll give you a 30-minute time slot, and when you first get in there, they'll say like, I'm kind of double booked here. I've got 15 minutes of the 30 that we had set aside. So, right off the bat, that can throw you if you weren't expecting it. Like you have a 30-minute spiel, and now you just got half the time. But that's, policy staffers especially are pulled in a lot of different directions and have a lot of ground to cover in a day. So it's really vital for us to be able to be succinct and talk right off the top. A number of folks, when they go visit offices, are disappointed that they didn't meet with the policymaker. They wanted to meet their senator, their representative, and especially if you've traveled to go have this meeting, you're really hopeful to talk to the decision maker. And I would encourage you, do not be disappointed in that. The staffers can be your best advocates for getting your message through to the office and having the office kind of take this up as something that they really want to champion. The staffers have a lot more time relative to the policymakers to dig into an issue, to actually read the materials that you brought to them, think about how this fits into not only the office's agenda, but the other offices that they might caucus with, that they tend to kind of work on projects together with. So there's a lot of kind of background that staffers have time to run down that a policymaker just won't, because they have so many different demands on their time. So given that time constraint, you really want to go in with one point. Um, you, it's really handy to have a one pager. We call it a one pager. It can be one side or two sides of a page, but it needs to be succinct and just hits, the high points of what you're trying to convey. And you don't want to spend all of your time presenting and then run out of time for the office to have a chance to kind of reflect back to you things that they're thinking about. And there's a couple things you can listen for, especially on initial meetings with an office. One is what the office will usually say what their priorities are, kind of relative to that issue, and that'll give you a clue like, is this really something that's central that this office would want to champion, or is it lower on their list? If it's lower on their list, there might be a better place for you to go talk to. And most offices are really good about that. They'll tell you, like, that's actually not our specialty, but there's another, Senate office down the hall that's really their thing. They really enjoy getting into that particular, aspect of healthcare or aspect of research. And I recommend you could talk to them. And we've got these impressions from watching the popular media that, there's this political divide and, the parties don't play nice with each other. But I can tell you at the staff level, there's a great deal of collaboration. Most of the policies that we pass require, bipartisan activity, and staff constantly kind of are working together and referring, experts to each other across the aisle. So it's really refreshing the kind of nonpartisan or bipartisan cooperation that you see among staffers. So when you go into an office, a couple things to kind of keep in mind to help you be most effective. Um, Humans, despite, us as academics, we're very, in our head and cerebral about things, but, a lot of human activity is driven by our emotions, right? So when we go into an office to try and capture the attention and really engage, the office at an emotional level, it's helpful to start with like a story of an individual, like something that happened to a real world person and what was their experience like, and talk about that in a way that's vivid, where the person you're talking to can really take the perspective of somebody in that situation. If they've got a rare disease or a special condition, what's that like for them? Um, but then you can follow that kind of individual story up with data. I think data only matters after you first, made somebody care, about the issue that you're taking to them. So the data does something that shows like this is a phenomenon, not doesn't just affect this individual I'm talking about, but what's the proportion of people in America who experience this condition, and what's some important data points that paints a fuller picture of like how big is this issue. Um, and I think as academics, we're really good at that. We can document in a lot of different ways, how big of a problem is, but we sometimes have less practice at, following that immediately with like, what's the solution? Like, don't just show up at the office and say, this is a problem. um, you really need to go in there with a solution, because that's where the traction is going to come on in terms of moving something forward with the office. Once you've articulated those points, you need to move those points relatively quickly. You need to demonstrate a couple other things about your approach. One is define your coalition. So, like, is this just an idea that Charles Mathias thinks is a good idea, or like have a lot of people like that I might recognize sign on to this as like as a good solution? Like, are there professional societies who have endorsed this and signed on to it? Are there community organizations? Are there businesses who have signed on to this? That gives credibility that the solution might be acceptable, when it comes time to implement it. It's helpful if you can position your uh, your dialogue with knowledge of what that member has done previously. So if they've previously voted positively, on issues that are kind of similar to your topic, that's really encouraging, and you want to reflect that. Like I know, your boss, if I'm talking to a staffer, if your boss has, tended to vote for this kind of health intervention, this is another kind of aspect of that. It's very consistent with their voting record. That is really helpful for them. Members do feel a certain level of need for consistency in the way that they vote on things. And if they've always kind of voted in one direction on a particular issue, and you're kind of bringing them something that's the opposite direction, that's going to be a tough one. That's going to be a tough one to convince. And so part of your education for that office might be about how, your issue, how it's different than the way they voted in the past. And then finally, it's vital that you acknowledge what the opposition to whatever your solution is saying. Don't ignore it. Point out, like, you might have other advocates come into your office and tell you this is a bad idea, and they're going to say it's a bad idea because of X, Y, and Z. And and while X, Y, and Z may be true, and then I'm going to counter that. I'm going to say, well, but there's actually another factor, A, B, and C, that kind of outweigh that. And in the scheme of things, it's a net positive, the solution that I'm promoting. So it makes you seem more like an honest broker, more credible when you acknowledge there is, opposing views, and it also gives you a chance to kind of counter, what the opposing view is with your evidence. There's also some things that you probably want to avoid doing. The first is lobbying. I'm going to define that here in a minute. The second is talking in a partisan way. So you're talking in an office that the head of that office is a politician, and we use politics to move policy. But for you to be seen as an honest broker of information, coming in from a political kind of angle, kind of even if that angle agrees with that office, it takes away some of your credibility. Also be aware of jurisdiction. Jurisdiction means who has control over that policy. If you're advocating for something that has to do with how, like my topic area of how people with mental illness are treated in jails, the jurisdiction for jails in the United States is primarily at the county or parish level. It's the sheriff or the police chief that really dictates what happens inside of jails. So going to the U.S. Senate or U.S. Congress, that's a mistake because they don't really make the policies that dictate what happens in local jails. Watch out for solutions that benefit just like one person. Like, right, we worry about, even in academia, about setting precedent, right? So precedent should be something that's for the good of many, not just one individual. And just be aware of the members' past positions on issues. I want to make sure we're leaving enough time for Q&A, so I'm just going to kind of run through the next ones a little bit more quickly. But the point of these is that there's a lot of ways you can get involved in policy activity. And I am kind of making that case. I should kind of define what advocacy and education is. So advocacy is kind of an insider approach to conveying information to help policymakers make good decisions. And that's very, very similar to kind of an educational kind of approach. Advocacy might be a little bit more persuasive in that, you might have a preferred solution that you're promoting in particular. But advocacy is really different than activism. Advocacy is more like an insider approach where you come alongside a policymaker to think about solutions, where activism is more an outsider approach where you try and create change through creating pressure, basically, on the system. And then the last thing is lobbying. Lobbying is a particular part of the tax code, and that has three kind of central components to be a lobbyist. One is that you're interacting with the policymaker, you're asking them to vote in a particular way on an issue, and it's on actual or pending legislation. Let's see. Um, I'm going to jump around to just watching the time. So, in terms of how you can become involved in policy, one is just civic engagement. Be informed on what are the policy issues that affect the topics that you care about. Know who your representatives are and vote. The next level is you actually meet with your elected officials and use your professional voice to help them understand the evidence and that you are a specialist in. You can actually join organizations that make it a lot easier to get involved with policymakers. There's a link here for TrustAlink, which is a research policy collaboration. And they actually have a network of researchers that they maintain. And when policymakers kind of have a question about a particular health or science topic, they'll send that out to the network and people can respond. You might participate in written materials or even office meetings, based on the connections that they can help make. Another way is through fellowships. Depending on your career stage, there's a variety of different fellowships out there that allow you to have kind of a temporary service within a policy environment that really helps you understand from the inside how policy decisions get made. That's really beneficial for your success in policy interactions, but also can be great for your career. And finally, you can actually gain employment, either as a policymaker yourself or as a staffer within a policy office or an agency or on a board that kind of consults or provides expert kind of evidence to policymakers. And with that, I'll open up for Q&A.
Thank you. Thank you so much, Dr. Mathias. That was great. I've gotten a couple of comments in the chat about how helpful your slides are and people asking about that. So don't want to put you on the spot, but we can check with you afterwards to see if you would be willing to share with
Happy
others.
to share them.
Okay. All right. So who has questions? Because I know I always have stuff. So one thing I thought about, I was thinking about, what's happened now in this new sort of social media age, because you had mentioned, the fact that researchers don't engage as much with policymakers, and I'm wondering whether you feel like you've seen that change as a result of, so many people being active now on social media.
Yeah, definitely social media is a very powerful tool for, gaining visibility. And I think, as researchers, it's really important that we kind of are speaking from our place of strengths, which is the evidence and kind of the tools that we use, like how can those tools be helpful for understanding, something that's in the public conversation. So, there's a lot of different kinds of um, approaches, I think, are frames that people use on social media to get visibility. But I think just don't forget who you are, like and the strength that you're coming from, and be aware of the voice that you're using when you're kind of posting information online.
And I think that's important because there are so many voices going on at the same time. And you, as an expert in something, you don't want your voice to just sort of blend in with the rest of the noise. You have to, I guess one of the things to be clear on is to articulate like who you are, like you said, and why you feel like you have the credibility to make a particular statement or to advocate for a specific position on something. So I
I
know.
think I think a good test that I always try and use when I'm considering sending a message out is like, is this message, adding value to this conversation because I'm bringing some new evidence or a new perspective?
Yeah.
Or is this really just my opinion? Because everybody's got an opinion, right? But I don't know if I'm creating value just by sharing my opinion. I think I create value when I can kind of bring that evidence or perspective.
Great point. Let's see, I was trying to see if anybody else had a question. I know one of the things that I struggle with is the whole thing that you mentioned about the fact that we in academia are really taught to focus on um, to be very cautious in the conclusions we draw about our work and to be very transparent about all the different limitations and all the uncertainty and all of that. And, I wonder how you get to the point where you feel comfortable enough being definitive about a solution you're putting forward, um, you know, because of everything that we're taught about, like saying, well, I don't want to overstate, like, do you feel like that it needs to be based on several studies, or let's say you just have one study that has like great findings? Do you feel like that's good enough, to go out there and sort of push for something?
Great question. And I love that question because it when you're first getting into this area, it really can be a different set of norms that you're trying to operate within than we're used to in the academic community. And it can raise like a lot of discomfort because, we would always like that next study to provide more certainty. And but you have to realize for some policy uh, contexts, like a decision has to be made. Like, there's just, some kind of pressure or event that's going on that a decision is going to have to be made about this issue. And we can't wait. So in that context, would you rather the decision to be made in the absence of any evidence, or would you rather say, this is, as far as we know, this is what we know so far,
Mhm.
and I think that's better
Mhm.
to have some evidence to be one part of the decision making process rather than no evidence.
Yeah. Right. Let's see, there's someone in the chat saying, great, Michelle Howe saying, great information presented here. Thank you. Before reaching out to electeds, I might suggest also reaching out to ASTHO and or NACHO. These are professional associations, public health associations, depending to learn if and how state and local public health is currently involved in the issue. I think that's a great point, and I'll let you, speak to that, Dr. Mathias.
If your professional organizations are your best friends on this because you're already a member, you paid your dues, and you participate in them, lots of times for the scientific or part of the work. But all these organizations have a policy unit that's one monitoring like what are the issues and that are going on right now. So they kind of synthesize the current policy context and are a great way to get up to speed on like what's happening, in your field or affecting your field. And then they also usually will create, priorities or documents that kind of you can borrow as evidence or use in the way you talk when you meet with policymakers. So, and they even have like hill days where, well, they'll take people along with them to go meet with elected officials. So, great question.
Claire, you have a question?
Yes. First, thank you so much for your presentation. I definitely learned a lot. I have a strategy question. So I don't know everyone in the room, but I feel like a lot of us study chronic conditions or health diseases. So there's not really a sense of urgency for politicians there's no crisis that they can build momentum off of. So I'm kind of wondering for those who are advocating for a change in chronic health disease management, what advice you might give for talking to politicians or change makers?
No, that's a legitimate concern. And when you look at how we've invested our national health expenditure dollars, they tend to be in more acute things, and we wait until people get very ill before we make an investment in that. But when you just look at the trajectory of our national spending, and then also the outcomes that we get in the U.S. compared to other high income nations, we're just getting crushed. We are it just every year we keep saying like this spending level is unsustainable, and at the same time we're just not getting the outcomes. It'd be one thing if we spent the most, but we had the best health in the world, but we just don't. And the reason why is chronic conditions. Like that's what sets the U.S. apart from a lot of other kind of peer economic nations, is that we just have a lot more comorbid chronic conditions, and they're very expensive, and across the lifespan, it just cumulatively grows in expense. So I think our solution out of this really bad scenario of cost and quality is by addressing chronic conditions.
Thank you. Joshua?
I'm from the JHU newsletter. I just wanted to ask if you had one message to public health students at Johns Hopkins as they're entering the workforce, as they're going to start to try advocating, and then for engineers and future researchers at Hopkins, future academics, if you could sum up your message in one sentence, which I know is impossible, what would you say?
I would say that to have for your work to have true impact, it needs to touch communities beyond just the academic circles that we spend a lot of our time in.
Thank you, sir. I appreciate it.
So is that a plug for, it sounds like it's a plug for us getting outside of our offices and classrooms and laboratories and actually going to the people and the places that we are hoping to to see the problems that we're working on up front, and using the stories directly from those places to to inspire us, right? And even in many cases bringing some of those people with us, right? It sounds like that's what you're
Well,
advocating.
well said, Dr. Cooper.
Anybody else? Chin up, Dr. eBay.
Hi. I don't really have much of a question. It's just more of a reflection or comment. First, I just wanted to thank you so much for such an outstanding talk. On a personal note, I've never taken so many notes on a jam session before because you provided such concrete guidance on specific steps to take and how to engage with various, various groups of people within the policy realm. And I found it really helpful. Um, I also just wanted to say that I appreciate that throughout your talk, you emphasize that researchers actually have the skills already to do this sort of thing in terms of synthesizing information, and that it doesn't take much more beyond a peer-reviewed publication to extend the work to figure out how do you make this accessible to other audiences outside of those within your profession. So I just wanted to thank you so much for that message. I think it's very timely, and it's a great way, honestly, to even kick off the next academic year of jam sessions, because to me, it really grounds everything that we should be thinking about in the months and years to come. So I really wanted to thank you.
Thank you. Thank you, Rick Ramos.
Thanks. Let's see. We have another question. We have a question from Katie Dietz. Thank you for the wonderful talk, Dr. Mathias. Could you speak a little more about presenting the opposing viewpoint, particularly in this climate, without seeming overly political?
Well, I think what you want to do is know, the opposing viewpoint well enough that you can understand, like, why would somebody hold that opposing viewpoint? Like the people, people have real reasons for the views that they hold. What are the reasons, behind that viewpoint. So I think it requires a true empathy, for folks that might have a different view, to understand, where are they coming from? Like, how did they kind of get to that viewpoint that they have? And if you can first appreciate that about, how they got there, your counterpoint is not to demonize them or, insult them. It's just to explain, how a solution that you have, creates change that, I think we can all agree on, or an improvement in things, which, you know, folks with opposing viewpoints, they are passionate about the same topic that we care about, right? So we have a shared interest in a topic. We have different ideas on how we might create solutions, but we actually share quite a bit. It's much more beneficial to be, dialoguing with somebody who's passionate about the issue that you care about than somebody who just doesn't care, right?
Yeah, that's a way to look at it, a glass half full perspective on the current situation. It's like, yeah, we all care a lot about this, even though some people may care about it for a different reason or have a different idea about what the solution is. So we have another question in the chat. This is pretty long, but from Lucine Francis. Thank you for your insightful presentation. I greatly appreciated your perspective on the role of researchers in policy engagement. Since my work focuses on nutrition policy, I was particularly interested in your point that it is not ideal for us to lobby or align ourselves with lobbying organizations. Could you clarify the distinction between a lobbying agency and an advocacy agency? For example, is the difference that lobbying agencies focus on directly influencing legislation, while advocacy agencies may emphasize public awareness, education, or grassroots mobilization?
Great question. Great question. So lobbying's kind of used in two different ways. Like I said, lobbying is really a distinction within the tax code that says, if you make a certain amount of your income through these activities where you interact with elected officials on pending legislation and tell them to vote or ask them to vote in a certain way, that meets the tax definition of lobbying, and that affects how you file your taxes. But all of us are in organizations that has a policy about lobbying, and usually our institutional policy about lobbying is much broader in terms of being cautious about how you're interacting with elected officials. And that actually has nothing to do with taxes. That usually has to do with your organization's priorities, because our major health science centers or universities, they are going to elected officials and have requests for certain priorities for the organization. And then if Dr. Mathias comes along and goes to that same office and has a request on something extremely rare or small, or very important to me, but maybe just a smaller part of the pie than what the organization's doing, that can complicate their efforts. So our lobbying policies have to do with just making sure you're in sync with your organization's government relations. Usually there's an office that you can call and explain what it is you're trying to do, and they'll advise you. They can actually be, really great help to you in getting into offices, but they'll usually tell you where the boundaries are on kind of how you talk about the work that you do. So that's a great way to understand, like, where's the safe place in advocacy and education, by using your organizational kind of department for that.
Hope that was helpful. Good. Yes, it did say that was helpful. Other questions? I know it can be sort of like a gray area, but we just spoke. I was in another session where we spoke with someone from the government Affairs office at Johns Hopkins, and he was saying the very same thing, that it's just nice to be in communication with them. So, so in fact, you could be sort of advocating for the same thing, but the policymaker you're talking to is like, once they know that you're a faculty member from Hopkins or whatever, they see you as being part of Hopkins. And so you would have to be very clear about whether you're speaking. For the most part, when we speak to policymakers, this is one thing I definitely heard clearly today. We're speaking on behalf of ourselves. We're not advocating on behalf of the institution, because we're not authorized to do that. So as long as we are clear that we're speaking based on our own personal and professional expertise as individuals, we're not speaking on behalf of the institution. That's good, but we should also be in communication with our institutional officials, so that we're definitely not. They're not going to tell us what to say and not say, but it would be helpful if they knew what we were going to the policymakers to talk about.
That's a great point, Dr. Cooper. And if what you're advocating for is really mission aligned with the institution and very consistent with, what your organization is doing, it's totally appropriate to acknowledge that you're there as an individual, but you might still have on, your white coat and your logo. But other things that may be a little bit hotter topics or a little bit, more controversial, they might say, well, we'd rather you not, display your affiliation, and you can still represent yourself as like, I'm an expert at a major, medical center here in the area, but you just don't want to appear that you're speaking on behalf of the organization.
Okay. Well, there's one more question that our Michelle Quinn says, are there surprising ways that speaking with a policymaker staff differs from speaking with the press?
I think so. I think policymaker staff are really good about kind of understanding, like, when you bring evidence to them in an advocacy kind of perspective, they're really good about kind of connecting that with other evidence they've heard in other organizations that it might have came to them with either similar messages or contradictory messages, and to try and understand, their own synthesis of the topic. So I think that's the kind of angle that they're lots of times thinking of, like, who said this before, or who said something that's contradictory this before, and how does that add to my knowledge and then inform the work that I do in developing policy. And I think the media are more looking at from the angle of, if I'm trying to give visibility to an approach or a topic or a story, how can I present this in a way that's going to be engaging and really drive engagement or attention to that story.
Well, if there aren't any other questions, I think we can thank Dr. Mathias, and really appreciate you coming and sharing your experience and expertise with us today. And as you mentioned, you'll share your slides with us for the Center for Health Equity, so that our training our training core can share them with whomever writes us to request it. And we just really, this is really great. It's encouraging, at least gives us like some baseline knowledge and a framework for proceeding, even despite the, challenging political climate, that we can still make a difference, even on a local level, as well as, on a national level, by really using our expertise and our voice to serve as consultants, and to influence change in a positive way based on what we know to be good evidence. So thank you so much.
Dr. Cooper, thanks so much for having me, and I'll include my email with the slides and encourage the audience to please reach out to me if you have follow-up questions or want to connect.
All right. And thanks everyone for staying on, and we'll see you next month.
Bye, everybody.
Thank